Hello, and welcome to day 25 of Movember 2024. In today's video, we're going to be looking at another strand of leukemia, AML. So what is AML? Acute myeloid leukemia, or AML, is a fast-growing type of leukemia, cancer of the blood, which affects the myeloid white blood cells. This cancer affects the number of healthy cells in your blood. This can cause problems with fighting infection, carrying oxygen, and bleeding. So what are the symptoms of AML? Many of the symptoms are caused because leukemia can stop your body making enough normal blood cells. Symptoms vary from person to person and on the blood cells affected. Possible symptoms include tiredness, fatigue, shortness of breath, weakness, headaches, pale skin caused by fewer red blood cells, also known as anemia, recurrent infections or high temperatures or fever, not enough healthy white blood cells, blood in your urine, gums or stools, unexplained bruising, tiny red spots on your skin, not enough platelets in the blood, serious bleeding, aching bones and joints, too many abnormal cells in your bone marrow, weight loss or loss of appetite, lethargy, lack of energy, enlarged lymph glands in your neck, underarm, stomach or groin, enlarged spleen, poor appetite, swollen tummy or tummy pain, sepsis. You may feel generally unwell, have a high or low temperature, or feel shivery. All these symptoms can be caused by conditions other than cancer, but it's important to go to the GP and get any unusual changes checked out. Symptoms of AML can be vague and include lethargy, lack of energy, and general inability to do the things that you normally do. If you have symptoms that are troubling you, or new symptoms appear, tell your doctor. So what increases a person's risk of developing AML? Age. AML happens mostly in people aged over 65. Smoking. Chemicals in cigarettes can increase your risk. Gender. AML is more common in men than women. Exposure to radiation. This includes exposure to high doses of radiation in industry or nuclear accidents or to previous radiotherapy. Exposure to gases and chemicals. These include radon gas, certain pesticides, benzene and other chemicals found in industry. Previous cancer treatment. Previous chemotherapy or radiotherapy. Genetic disorders, for example Down syndrome. Blood disorders. This includes Fanconi anemia, myelodysplastic syndromes, MDS, and myeloproliferative disorders. Having a risk factor doesn't mean you will get cancer. Sometimes people with no risk factors get the disease. If you're worried, talk to your GP or talk to one of the Irish Cancer Society's cancer nurses. You can also call the support line on 1800 200 700 or visit one of their daffodil centres. So this has been Movember Day 25. Thank you very much for watching, and I'll talk to you tomorrow.